Hello, class. Today I'll be doing my presentation on nicotine addiction. So, nicotine addiction is characterized by a compulsive need to consume nicotine, a chemical compound predominantly found in tobacco products. And nicotine addiction stems from the substance's ability to rapidly stimulate the brain's reward system and the need to keep using the product. So, moving on to anatomy of how nicotine affects the body. Nicotine affects many parts of the body, including the brain, nose, mouth, heart, lungs, pancreas, and reproductive systems. As seen on the diagram here, it can change the way synapses are formed, affecting attention and learning in the brain. In the heart, it will make its way through the arteries, where it can negatively affect resting heart rate, blood pressure, and the cells that line the blood vessels. Inhaling nicotine products will cause lung irritation, chronic cough, risk of lung cancer. And in the reproductive system, studies have shown people who smoke are more likely to have fertility problems compared to non-smokers. For the normal physiology, the mesolimbic system will function as a circuit that detects rewarding stimuli and control the response to them. This pathway starts at the ventral tegmental area located in the midbrain and the nucleus accumbens. Rewarding stimuli will activate the ventral tegmental area, which releases dopamine into the nucleus accumbens and other parts of the brain, like the prefrontal cortex. The activation and release of these areas will let the brain and body know to repeat the behavior that led to the reward, which is the stimuli that caused the release in dopamine. So the main neurotransmitter in the system is dopamine, which is synthesized from tyrosine, an amino acid. The synthesized dopamine then is packaged into the vesicles in the VTA, awaiting a stimuli for its release. And dopamine receptors in the VTA utilize a negative feedback inhibition loop, where the D2 receptors sense an increase in dopamine concentration in the body, then signal the VTA to reduce the dopamine release. So moving on to pathophysiology. Using nicotine will release many neurotransmitters, mainly dopamine, and nicotine will bind to nicotinic acetylcholine receptors in the VTA and cause an imbalance of multiple neurotransmitters, including acetylcholine, glutamate, GABA, which causes multiple changes in mood, learning, and memory. And repeated exposure to nicotine can cause the nicotinic acetylcholine receptors to become desensitized and upregulated, leading to a higher tolerance and addiction. Likewise, the addictiveness of nicotine is caused by the imbalance and lack of neurotransmitters, leading to dependence and withdrawal symptoms. And it can affect it also affects the cardiovascular system, as chronic use can lead to hypertension, and it affects respiratory homeostasis as it damages the respiratory epithelium and paraciliary function and promote inflammation. For diagnosis, nicotine addiction can be diagnosed through multiple ways, that being questionnaires, physical examinations, or laboratory tests. Because it is a chronic condition, it has to be carefully monitored and treated over a longer period of time compared to other diseases. And treatments for this disease include nicotine replacement therapy, drugs like bupropion, and cognitive behavioral therapy. And nicotine replacement therapy helps to reduce the intake of nicotine through other intake methods. Bupropion acts as a norepinephrine dopamine reuptake inhibitor, which reduces cravings and withdrawals. And cognitive behavioral therapy can help individuals change smoking-related behaviors through coping strategies and stress management. And some side effects of these treatments include irritation due to the route of administration for the nicotine replacement therapy, and dry mouth and increase insomnia, dry mouth, and increased heart rate for the bupropion. And for the AI models, for AI models, there are multiple AI models that can help. One of them being machine learning algorithms, which can analyze electronic health records and identify patterns and risk factors with nicotine addiction. Likewise, natural language processing can also process patient responses to questionnaires and assess nicotine dependence and readiness to quit. And these methods can help personalize treatment plans to track effectiveness, monitor behaviors, and predict relapse. And moving on to demographics, according to the CDC, 90% of adults begin smoking before the age of 18. And in 2020, the US had approximately 12.5% of all adults using some form of nicotine, which is more than 30 million people. Uh, Outside of the US, smoking rates were found to be similar, if not higher, that being with China being the highest at 26.6% in 2018. And in the US, mortality rates for smoking nicotine is approximately 480,000, which includes secondhand smoke exposure. And globally, this increases to about 8 million deaths a year globally. And studies have shown that life expectancy for smokers is reduced by at least 10 years. And here are my references, and thank you very much.